Hi, I'm Tazin. I am the CEO of Sprea Foundation, which is a Washington-based nonprofit. I was born in Bangladesh. I was there till I finished high school and I moved to the US. But when I was growing up, I saw people suffering from all different aspects of life in terms of poverty and everything that comes with it. When I moved here, I was one of the lucky ones to get education here, and then that always was in the back of my mind. How can I get involved? How can I do something? And along with that also, I was always very involved in volunteering and different type of organizations, leading organizations from a very early age. I was a Boy Scout. That had a big impact on the whole idea of service. And coming to Microsoft was one of the key things also, because you come here, there's the Give campaign where the whole company goes crazy about helping out organizations, nonprofits around the world. Last year they raised about $106 million. And that gave me some idea of how can I start something and then help these people. When I first came to Microsoft, my focus was a lot on technology. And I was opening up a couple of computer centers to help with computer literacy in Bangladesh. But then these people that I saw growing up, people especially who live in urban areas and going through extreme poverty and live under $1 a day, and for them, I was thinking of how can I help them. And the idea of healthcare came along because healthcare is a huge need over there. And what was happening is in villages and other places, there were a lot of NGOs working, and in cities there are big hospitals but not accessible by this group of people. So I started working around developing a healthcare program. And when we first went there, talked to the people, and turned out that with the resources and budget and everything we had in mind, we can probably open up a full clinic that's open 5 days a week, half a day. And that's how the healthcare program started. And over the next couple of years we learned a lot. We changed our programs, we implemented things like social workers who'd go provide door-to-door healthcare, and we started seeing big results. And then that's when the healthcare program totally took off. And that happened for another 5 years or so. And the next step was realizing that healthcare itself cannot be a solution to breaking the cycle of poverty. And then again we went back to our nose. We went back to about going to the people, again studying their needs and everything, and we realized that we needed a more holistic approach of solving poverty. And that's when Sprea came into being, and then that's when we started our healthcare education and skills training, kind of the holistic approach. Sprea means strong desire, intention, and hope. And our hope and our desire is to help people break the cycle of poverty. And right now, all our programs are in Bangladesh. We focus on people who live in urban slum areas. The three pillars we have are healthcare, education, and empowerment, or skills training. So within those, so for example, within our healthcare program, we have doctors and nurses. We have a clinic where we're getting all the basic healthcare needs of the population over there. But at the same time, we have specific programs. For example, we have a program for pregnant women, where anytime someone is pregnant, they are under our care all through the pregnancy, and then having the baby delivered, and then all the vaccination, all the basic checkups, and all of it, we provide that. We have other programs for children like malnutrition. And then we have special programs that we do like eye camps and blood grouping camps, vaccination camps, all of that. So that's the healthcare part. And then we have our education. Under that we have preschools and after schools. Our preschools are for 3 to 5 year olds, so that we prepare them to go to mainstream school. And then once they go into mainstream school, that we have partnered with our after school program, we provide them support so then they don't drop off, because there's a high dropout rate over there. And finally, the skills training program, which is a lot of training, career training, for example, computer technology, art and music, and different types of photography, all sort of different classes that we provide them. And we also started training for adults, where it's more like sewing classes, food preparation, so things that help them get a better job. So those are our skills training program. Overall, like, we think of it as a holistic approach, or our 360 approach. If you think about it, if we start with when someone is a pregnant woman, and then the child is being born, so we help with that. So with our healthcare program, a baby is born, we make sure they are born healthy and then safely, and then they grow up. And then we have our education program, where that same, the kid that was born, now they're getting into our preschool and then getting ready for school. And then with our after school program, we prepare them to have finished their studies and then finish high school, go to college. And then we have the empowerment or skills training. Under that, they get trained to get better jobs. So within this, at the end, the goal is they'll be able to break the cycle of poverty and have a better life. At Microsoft, I work as a user experience researcher. So a lot of my work is just observing people, looking at their behaviors, analyzing that, looking at trends, and then looking at all those aspects of human behavior. How can we transform that into design ideas for products and softwares and services? And I think Microsoft has a huge impact on Sprea, because, as I say, like, one of the key pillars of Sprea is to understanding and then coming up with solution from their perspective, the people we are serving. The same thing I do at Microsoft is pretty much the same thing I do in Sprea, in terms of like going out and meeting people, understanding their needs and implementing solution that helps them. So the way we provide service to the people over there is by community and the areas we work in. So whenever we go to a new area, we survey the area, we look at the needs of those area and the people over there, and then we decide whether this area is something that we should take under our care. And then once we do that, the entire community is provided those services. We open up schools over there where they send their kids. They come, our social workers go over there for the door-to-door health service we have, and then they also come to the clinic to get treatment. So all of that, so it's all part of like a community-based approach, because one of our big pillars or like key strength that we have is our community engagement. We work in such a way that we become part of the community and part of the family, and it's like any time they have some sort of even like family matters they need help with, they'll come to us, and that's how integrated we are. So every staff we have is Spreeha, including even myself, like we are all very connected to the community. They're going there every day, meeting up these people, getting to know them, and then becoming part of them. And then same with me, whenever I go, I spend a lot of time in the slums talking to people, what their needs are, like how can we improve our services, and then we're always learning from them in terms of their needs and what works for them. And examples are like, even things like they just had a newborn, and they'll sometimes come to us, say that, hey, can you help us name the baby? Or like sometimes like they have other things, like some husband and wife maybe had an issue, and they'll come to us, hey, can you resolve this for us? So it's at that level. And also like we are always very connected with them. Even me being here, I'm connected with a lot of them through like technology, like mobile phones, and that's something that everyone has access to over there. I text with them sometime, getting to know like how things are going. Like the kids in our school program, a lot of them have Facebook accounts, so we keep contact through that also. So we are always very connected with all of them. So in Bangladesh, we have 37 paid staff right now. And then we have a group of volunteers over there, and some of them are through different corporations over there. For example, we have a partner called Graphic People, Software People, which is a Danish organization, and then their Bangladesh office. But then over here in US, we currently do not have any paid staff. I do make distinction between like staff and volunteers. So we have volunteers, but we also have some people that we call staff. And the way I talk to them is like, this is a full-time job. with a salary of zero right now. and someday when Sprea is big enough to have paid staff over here, we'll probably will hire some of them. The way it works for those people who are in leadership roles within Sprea in US, they do have a second job, and then this is like one of their primary roles. They're very passionate about it. So, but at the same time, it's not just volunteering. They have to do it like a regular job.
Yeah.
So that's how we look at it.
Yeah.
We have many volunteering opportunities, and one of the way we try to recruit our volunteers is to look at what they're passionate about, what are their expertise, because there are like two types of volunteers: people who come in and then who want to just work and then gain some experience, and they're open to like any sort of opportunities. And there are also others who have some sort of expertise and they want to volunteer their expertise. So we look at, like, we talk to them and then think about like how can they be most effective, not only just like how they can Sprea can benefit, but also how they can benefit from the experience. So it's kind of like the whole part about like thinking from others' perspective, and then the people who are helping, people who are working here, that's really big for us. Like that's one of our core values, is like empathy. And then that whole idea of design thinking, which is like taking looking at a problem from their perspective and then thinking of a solution and then learning from it as we implement stuff.
Yeah. And
that's how, like, even in the slums, we spend a lot of hours just understanding where they're coming from, what are their needs, what are their goals, what's their lifestyle, not just looking at the issue, but looking at the story behind. And even our donors, we always look for like what's the best experience for them. When they're our events, our activities, when they're getting involved, how can we provide the best experience to everyone involved? In 5 years, I'd like to see Sprea grow more in depth and breadth. In terms of depth, we are pretty good at what we do right now, but there's also more that we need to do. For example, like our medical services. Right now, if someone comes in and needs a blood test, for example, we have to send them to one of our partners. Mm-hmm. And for those people, sometimes going to that partner organization and getting that done gets tricky, and then it's challenging. So we want to provide more services within our programs. But at the same time, in 5 years, I see Sprea growing a whole lot more, and then faster than ever. And then I also want to see Sprea like in multiple locations and also beyond Bangladesh, because we have built a model that we can replicate, and we have been replicating it for the last couple of years. But then in 5 years, I hope we are at a point we're more stronger to replicate it in multiple locations in different countries and solve poverty. I would say for people to just like check out Sprea, like learn about what we do, and support us. We are a young organization, but at the same time we're doing some incredible work, and Washington is a great place, and people here have been very generous and supportive with our work. Not just donating money, you can volunteer, you can help spread the word, you can connect us with people who might be interested in working with us, both organizations and individuals. So I just say, like, get involved and help us break the cycle of poverty. I think like my advice to anyone who wants to get involved, not just with Sprea, with any sort of like this kind of activities, is just be open, and you'll see a lot of things that will break your heart, and you will see things that you haven't seen before. But I would just say be optimistic, and then like come with an open mind and be ready to change the world. I think that's one of the biggest things you can bring is passion. If you're passionate about it, work with others, and you can solve big problems.